OSHA's emergency temporary standard became effective June 21st. Employers were required to be compliant with the majority of the provisions by July 6th, and with the remaining provisions related to training, ventilation, and barrier provisions by July 21st. So how are you feeling about this new emergency temporary standard, or ETS for short? Do you still have unanswered questions? Hello, my name is Linda Harvey, founder and chief knowledge officer for the Dental Compliance Institute. I'd like to share with you 3 common misperceptions that I've seen. First, hey, we're exempt from the ETS, so we don't need to do anything. And second, since we're exempt from the ETS, that means we're exempt from other OSHA standards as well as the National Emphasis Program that was launched earlier this year. And third, other practices at large healthcare facilities aren't screening and aren't wearing masks, so why should we? Let's take a closer look at those 3 details. So looking at the first misperception, you do have to do something in order to be exempt from the emergency temporary standard. There are 3 specific criteria that are outlined in OSHA's flow chart titled, "Is your workplace covered by the COVID-19 healthcare ETS?" Allow me to take a look at this with you. The first criteria states that you are a non-hospital ambulatory care setting. You can check that box easily as long as your practice is not within a residential program of inpatients. Second, all non-employees are screened prior to entry. Who are non-employees? Those are your patients, visitors, guests, vendors. And third, people with suspected or known COVID-19 are not permitted to enter. People means, again, patients, visitors, vendors, guests, as well as employees. So screening everyone that comes into the practice with temperature checks and screening questions is important. At the very minimum, your vaccinated team members should at least self-audit on a daily basis and record that they have negative symptoms. In addition, you must meet all 3 of these criteria, not simply just one. Now, looking at the second misperception, that if you're exempt from the OSHA's emergency temporary standard, you're exempt from other OSHA standards as well as the National Emphasis Program, and that is not the case. Exemption from this emergency standard only applies to this standard. As a matter of fact, last year, when you reopened your practice and implemented your COVID protocols, you probably implemented many aspects of the ETS already. Team training, enhanced ventilation, barriers installed at the front desk. So you're probably already doing many of those good protocols in your practice. Also bear in mind that if your office is inspected by OSHA through a random audit or a complaint, OSHA will ask for documentation verifying that you are exempt from this standard. In other words, what team training have you conducted? What does your respiratory hazard assessment show? What about your COVID plan? Well, no doubt in the past year, you've conducted your annual OSHA training or attended a CE course on this topic. However, what have you done to train your team members specifically on your practice and your COVID protocols? Related to having a COVID plan, OSHA provides a sample plan, and we'll put a link to that resource along with this video. In addition, the American Dental Association has a sample plan for their members as well. So either one of those resources would be great for your practice. Relative to misperception number 3, dentistry is still following the CDC interim guidelines from December 4th, 2020. And there may be some different and slight variations between our protocols and other areas of healthcare. So in making those comparisons across the board, it may not always be apples to apples. Therefore, it's always important to go back to the primary source. Check the CDC guidelines, look at the OSHA standards. Unless your state or jurisdiction has more stringent laws or standards in place, those would apply. Allow me to illustrate another thought related to OSHA's guidelines. I have some key words to share with you. OSHA states that most employers that are not covered by ETS no longer need to take steps to protect their fully vaccinated workers who are not otherwise at risk from COVID-19 exposure. Keywords, otherwise at risk. Except when measures are required by federal, state, local, tribal, or other territory laws and regulations. This means that under the ETS, fully vaccinated workers do not have to wear masks, keep physically distant, or use barriers. When in well-defined areas where there is no reasonable expectation that any person will be present or suspected or with suspected or confirmed coronavirus. The key words in those two statements are not otherwise at risk and well-defined areas. How would we know if our vaccinated team members are not at otherwise risk if we don't screen patients, team members, visitors, and guests upon entry, and that we're not protecting our vaccinated workers from unvaccinated workers? Although the numbers are low, there are still cases where there have been coronavirus breakthroughs, where even though you've been fully vaccinated, someone contracts this virus. The key words are not otherwise at risk and well-defined areas. So how are we ensuring that our vaccinated workers are fully protected? The types of things that you would want to document, assess, and document in your COVID plan would be along these lines. Are vaccinated team members allowed to be in a well-defined area? Are they separate from non-vaccinated employees? Or does everybody eat lunch together in close quarters, vaccinated and unvaccinated team members? Again, please address those in your COVID plan. As a closing thought, the CDC guidance does talk about wearing masks for source control. And when you consider the fact that there have been breakthrough cases, meaning that fully vaccinated individuals have contracted the coronavirus, it's best to be conservative, and even vaccinated workers continue wearing a mask for source control throughout the office. In this short video, I mentioned several OSHA resources, and we'll make that link available to you. In addition, if you'd like a short checklist related to OSHA inspections, I invite you to visit surviveosha.com. That website is surviveosha.com, where you can get a free short checklist for your practice. Thank you for joining me.